technology, etc. Now I would like to ask an honest question. At this juncture, however much we have advanced in our technology, can your therapy replace any technology alone? Can you raise your hands, please? Whether the technology can replace a human interaction, especially in psychology and psychiatry? No. Thank you. Raise your hands, please. Whoever says no. Thank you very much. This is what you should now know. You are going to be the catalyst and an ambassador. Okay? Why? This is what I am going to talk to you in 15 minutes, and I would like to take questions from you. Can a person be a catalyst? That's the question I wanted to. This was on my mind. Yes. Can a person be called a catalyst? The definition says yes. You can describe a person or thing that causes a change or event to happen as a catalyst. What is the catalyst? The catalyst hastens the process of recovery in terms of psychology. So, in the morning, a lot of questions were asked. That's why I postponed my talk to the last one. Now we will start with what is your role as a catalyst. Whenever there is a patient with psychological disorder who walks into any doctor's clinic, it is always a team which works with mentally ill patients. So that's why we call the treatment as biological, psychological and social. So in the short term, bio, psycho, social. So it is a team which works with the psychiatrist for the catalyst. You are the catalyst. For example, I would like to give any mental health care, if it is comprehensive, should have a psychiatrist to make a diagnosis. Second, a clinical psychologist, psychiatric social worker, a psychiatric nurse, and in some special cases, we would like to have special educator, speech therapist, physiotherapist, and occupational therapist. For example, day before yesterday, my colleague, psychologist called me. Sir, you have referred a patient with autism and behavioral issues. He is 19 years. Can you refer somewhere for social skills training and for occupational therapy? So it's not a small thing which they can get access to these things outside. So it's always a team which works. What is the role? Today, to be very honest, if you survey 10 people, if you have a psychological problem, or your relative or your children or any family member, whom do you want to consult? The first answer they say, I don't know whether I should consult or not, but let me go to a counselor. Because they don't know how to draw a line between a clinical psychologist, counselor. Probably in the layman's term, you people are called as counselors. So many a times they have less stigma to approach you people for help. You should be proud of that. Will you agree with me? Between meeting a psychiatrist, coming to a hospital versus walking into a therapist or a counselor, the patience and acceptance is more. So, stigma is universal. Stigma is universal. Don't think in the West that people will just walk into psychiatrists, everyone who has a problem. Only thing in a country like us, where we have many other ways to have access to treatment, may have resistance. So, the first line of destigmatization is you people. They come to a counselor. I want to tell advantages and responsibilities, part 2. Okay? In India, what happens is, whenever a person goes through some difficulties in life, he or she is bound to undergo psychological symptoms, feeling sad, anxious, crying spells, sleeplessness, etc. But you have to read a beautiful book called The Great Universe of Kota. It's a work done by Dr. R.L. Kapoor, one of the greatest psychiatrists, son-in-law of Shivram Karanth, and Carl Stairs. These are the two people who did a survey in a small village called Kota in Dakshin Kannada, Udupi. Now it's Kudapura near. So, how people will seek help when they have a psychological problem? Because that is the area where witchcraft, going to temple, rituals are much more than this part of Karnataka. I want to give one small example. A big contractor had a big project to do Unfortunately, when the project was on the progress, sudden rainfall, something like that, building washed out, he lost crores of rupees. Naturally, when he loses all the money, he will not be a happy man. What he will do when he is in distress, it is not a mental health professional he will run to. Probably he will go to temple, or he will go to a faith healer, or they will approach an astrologer. What happens when they meet an astrologer? Astrologer cannot get his money back. Can he get the money back? Definitely no. But what he does is, he will look into the chart and he will give an explanation. Because of this constellation of stars, you lost money. Oh, that fellow got some answer. That is why I lost my money. Then immediately the next question, he will ask, what should I do for that? So immediately he will give some rituals. And the person will think, if this time is past and I do the rituals, probably I will do well. With that hope, a lot of people may not reach the mental health professionals. So you should understand, if a lot of people will be shouting, India needs this many psychiatrists, India needs this many. But these cushions are available in the abroad? Hardly no, because these are all culture-bound syndromes. Second, we continue to have some support in the family. For example, if one person becomes mentally ill in the West after the age of 18, no parent would like to take care of it, because the government is supposed to take care. And they lose the partner. So actually the social support is less. So the society in which, now coming back to the thing, what I am trying to tell you is, when you want to start practice, please understand the culture of the place where you practice. We should respect that. One is destigmatizing, second is understanding the culture. The third thing which you should inculcate is accepting, understanding, or giving a patient listening to the clients who come and give their own explanation. I am not talking about Dr. Google. I am not talking about Dr. Google. I'll just give one small example. Yesterday, one gentleman came. He said, Doctor, you are treating my wife and my daughter, Dr. X ABCD, and my daughter's name ABCD. I said, Doctor, by that name I know many lady doctors who are my students. I don't know whom you are talking, etc., etc. Live apart. Then he said they are living separately, they have deserted me, they don't want me to join them. Then I asked, what efforts you have done? Do you know what he said? I am a pranic healer, doctor, pranic healer. For last 1 year, I have done so much pranic healing for my daughter. Nothing happened. I did not laugh. I said, do you know what is pranic healing? It's a belief. Is there any scientific validity? Absolutely no. I go to a temple, I get one talisman tied, and I have a hope something good will happen. Same thing has happened to you and your daughter. And this gentleman left at 3:30. Then the evening, 6:30, I see the mother and the child in the clinic. I said, today I am not given appointment. I told them to come on 12th with the husband. Why did you come? They were surprised. When did my husband come? The doctor was asking. I said, he came at 3:30. Then I asked, what made you people to go out? The wife said, whole night he will be telling that I am doing pranic healing and not doing any work, doctor. Daytime he is sleeping. Thank you very much. And he told, please go out of the house, keep doing pranic healing. What I am trying to tell you is, sometimes I did not confront that fellow. That's why in North India, especially, people have deep relation to culture. They say, dua and dawa should go together. Means, let us accept what you do, but I will not validate. I tell, okay, that was your belief. So that's why I told the gentleman, all three of you come for counseling. Probably I will be able to understand. I did not tell you pranic healing did not heal, it's only bogus, it is simply sham. I did not tell all those things. So, request to budding psychologists, respect, don't accept. Give the alternative model, a scientific model. Okay, you so far you went to these temples, you so far you did these rituals. Okay, it's alright, but probably I would like to tell this illness is because of these things, this therapy will benefit. So, third thing what I am telling is, respecting their beliefs, giving an alternate model, not accepting their beliefs. Clear? Because as a budding psychologist, you should know. Next, most important, whenever you start practicing, how many of you would like to start practice after completing your course? Please raise your hands. would like to be a therapist? Okay, good. First and the foremost we should learn is respect the patient. Not all patients are good. You will come across good, bad and ugly. Some are very nasty. After all your best efforts a day, what madam, you took 10 sessions with so much of money and nothing happened. Probably the therapist would have put in all the efforts, but it is not one-way traffic. Even the person should have understood and practiced what the therapist has told. So that's why you should not get offended by that. When you come to such a conclusion, you have two ways of doing. One, you can tell them, kindly tell me why my therapy did not help you. Jot down 1, 2, 3, 4. Okay? Then you can tell, probably I'll give you a free session. I will be in a better position to explain to you. Go back home, do the homework. Where did I go wrong? Or what the patient did not, the client did not do what I said. Write down, come back in the next session you can do. Or if you have come to a dead end, it is always better to transfer to one of your seniors or another trusted therapist. Many a time, just change in therapist itself may change the attitude of the patient. Okay? So, what I am trying to tell you, when you get into practice, you need to learn all these things. That's how you can become a catalyst in the moment. Why you are called as a psychologist as a catalyst? Are you really a catalyst? I firmly believe yes. Even in a patient